Hello, my name is Carolina Bottari. It is with great pleasure that I will be presenting to you a conference entitled Clues to an Undiagnosed Traumatic Brain Injury. I am a full professor in the School of Rehabilitation at the Université de Montréal and a researcher at the Center for Interdisciplinary Research and Rehabilitation of Greater Montreal. I will start by introducing myself and explaining to you a little bit the context of this presentation. So I am an occupational therapist with PhD training in research. I've worked for over 30 years in the field of traumatic brain injury and published over 80 scientific papers. This is really my area of expertise. And my area is more specifically cognitive rehabilitation, which I will be addressing within this conference. I've worked in the areas of acute care rehabilitation and community-based rehabilitation, and I've trained hundreds of occupational therapists, some who are currently clinicians as continued education, and also hundreds of occupational therapy students at the university over the years. I'd like to start by just defining what we'll be talking about. So what is a traumatic brain injury? So traumatic brain injury basically occurs when there's an external force that is applied to the head or body and which alters brain function. It is a highly prevalent injury, though, so over 50 million people sustain a traumatic brain injury each year, and it's been recognized as one of the leading causes of death and disability by World Health experts. There are numerous challenges associated with traumatic brain injury. I will name a few here. So injuries to the brain frequently go undiagnosed and untreated. In Canada, here, and some of the populations that I work with are victims of intimate partner violence and homeless people who often have injuries to the head from trauma, and these are frequently undiagnosed and untreated. Mobilizing trained professionals to diagnose and treat brain injuries is essential, but not always possible. So the diagnosis is a big challenge. People do not always go to the hospital to get a diagnosis. Sometimes they wait until they realize that their symptoms are not going away. And by then, sometimes it's a little bit difficult to know, was this caused by a brain injury, or do other factors explain the symptoms this person is experiencing? So the diagnosis is really important. It has to occur early on after the injury. But it's not always possible. In situations where there's no established continuum of care, there are minimum practice standards that exist and should be followed. The World Health Organization has recently published rehab packages for traumatic brain injury. These offer important guidelines. I was one of the consultants on the development of those guidelines, and that's why I'm very interested in sharing with you today some of the work that's been done by experts around the world to try and bring traumatic brain injury rehab guidelines into areas or countries where this may not yet be overtly present. One of the areas that I am most interested in are the long-term repercussions on independence and everyday activities of these injuries. So I work a lot at treating and evaluating people to see the impacts on their self-care activities, domestic activities, return to school, return to work, their ability to drive after traumatic brain injury, and also their ability to do leisure activities. From what I've read, there are certain challenges with traumatic brain injury treatment in Ukraine. So conflict-related traumatic injuries and forced displacement of millions of people are expected to create an enormous surge in rehabilitation needs in your country. That's why I was particularly interested in participating in this conference today. And according to a recent WHO report, the conflict in Ukraine will create a huge rehab surge that will be complex and long-lasting. And so I understand from this conference that your country will be looking to develop collaborations with experts around the world to try and help the treatment of this population. There are numerous mechanisms of injury that can lead to traumatic brain injury. So car accidents can lead to brain injuries, falls, sports-related injuries, and blast injuries, which we do not see in Canada, but which I'm expecting to be one of the main mechanisms of injury in the context of war in Ukraine. There are frequent clinical signs. I will name some of these clinical signs here. So headaches, nausea, dizziness, altered self-awareness. Many people who have sustained a traumatic brain injury are not aware of their deficits. People can complain of blurred vision or double vision. They can have attention deficits, a lot of emotional symptoms, irritability, aggressivity, anxiety, depression. A lot of people will complain of light or noise sensitivity. Many people will say that their thinking is a bit like it's in a fog, so decreased speed of processing. A lot of cognitive fatigue and sleep disturbance, which are different from the post-traumatic stress symptoms that we can see. This is really just specific to traumatic brain injury. A lot of memory problems, so people will complain of trouble remembering, altered judgment, executive function deficits, which I will come back to, language and communication. So the focus of my research work, which I wanted to take a few minutes to speak to you about today. So as an occupational therapist, my area of expertise is really everyday activities. So what I contribute as a professional to the interprofessional rehabilitation team that works with these people is my area will be to look at the repercussions, particularly of the cognitive dysfunction on independence in everyday activities after traumatic brain injury. So I also do work with all of the physical dysfunction or deficits that can occur after traumatic brain injury. So I will do all of those interventions and look at that. If there is spasticity, if there are balance issues, I will look at all of that. What we see more often, particularly if we consider also mild injuries, are cognitive dysfunction. So I have worked for many years now on developing an evaluation tool to guide occupational therapists when they observe a person doing everyday activities so that they can try and identify what is causing a breakdown in tasks. Are there certain things that this person does that makes them unsafe in their injuries, unable to be independent? What types of assistance does this person need to be able to function in their everyday activities? So that has been what I've been working on for many years. Just to give you a bit of an idea of how I situate this work. So I've positioned here the disability creation process. I understand that in Ukraine, you have really been looking at the ICF, so the international framework for disability. So this is quite a similar framework. So we will look at risk factors in terms of injuries, personal factors, the person's abilities, strengths, impairments, the impact of environmental factors, and the interaction of all of these things on life habits. So a lot of my work has been at the intersection of looking at this person's ability within her environment, facilitators and obstacle, how does that impact her everyday activities? And one of the models that I've used that to try and really delve deeper into understanding this person's difficulties is a model of cognitive functioning that has helped me, that helps me when I do an observation to understand where the difficulties are. So this is a summary of Luria's model of cognitive functioning. People who have sustained a brain injury will likely have deficits or lesions in the frontal lobe. They can also have lesions more posteriorly and subcortical lesions as well, all of these lesions will impact the person in their cognitive functioning and in their ability to do everyday activities. So this model has been particularly helpful for me in developing an evaluation tool and helping me train occupational therapists to know what they're seeing in everyday activities, whether there is or isn't a diagnosis of traumatic brain injury. All of these things can give us clues that there may be an underlying traumatic brain injury based on the deficits that we observe. I have been particularly interested in frontal lobe injuries because that is what is very frequent in traumatic brain injury. And we talk a lot about executive function. So my research work, we try and observe if someone has difficulty formulating a goal, simply deciding to do something, planning, so being able to figure out how to go about doing something. Is this person able to solve problems? Are they able to identify errors, which is often an area of concern in traumatic brain injury? So this person may do all sorts of errors, not detect them and not correct them, and therefore sometimes do end up with a result that is not conducive. For example, a meal that cannot be eaten because it was burnt and the person is not recognizing their errors. All of this is important to bring us towards treatment interventions. Sorry, I'm just trying to keep track of the time as I'm talking to you. So we have a lot of evidence now for rehab in the context of brain injury. So numerous studies have been done. We now have clear guidelines in terms of how to do evidence-based cognitive rehabilitation. So for me, once I have my evaluation results and I've understood this person and their everyday activities, and I'm able to see where there is task breakdown, what their challenges are, how that is helpful is that it helps me be able to then link those difficulties up with rehab interventions. Here I will be addressing more, not so much mild brain injuries, but more complex and moderate and severe brain injuries. So just to give you a very summary idea. So the first questions we ask ourselves when we start cognitive rehab is this person aware of their own deficits, or is there self-awareness? If the person is not aware of their deficits, we will use a series of evidence-based interventions that have been developed to help the person develop a self-awareness so that we can then do cognitive rehabilitation. If the person is aware of their deficits, they realize that there are certain things that they are no longer able to do, they are being challenged in their everyday activities. Our next question will be, does this person have any strategies to manage their everyday activities? So do they problem solve, and are they aware of abilities to plan? So if the person does not have that level of cognitive function, we will do what we call task-specific training. So for example, if this person is no longer able to dress themselves or prepare a meal, or parent and do activities with their children, we will practice that specific task. And that we can combine with using external strategies. So we may modify the environment to reduce the distractions. We may put clues in the environment to help them be able to do their activities, and we will simplify the tasks for them. If the person is at a higher level of functioning, so say the person has only mild or moderate brain deficits secondary to their brain injury, there is now a lot of strategies that have been demonstrated to be effective to train someone to be able to become more independent in their everyday activities. So we call these internalized strategies. For example, there is a strategy called co-op. So we will work with this person to work on their ability to plan. So we will sit with the person and help them say, what is my plan? We will help them develop a plan so that then they can go about and practice their plan, put it into effect, and we will follow up with the person to see if their planning is working well. So this was about what I thought I could share in a 15-minute presentation. I would be very interested in future collaborations, maybe doing some training, particularly with occupational therapists in Ukraine. If this is a very complex area of practice, traumatic brain injury is often invisible. We do not see it. So we need to find ways to observe the consequences of the brain injury in the person's everyday activities, to be able to find strategies to help them function better in their everyday activities. So thank you for your attention. I hope this presentation will be helpful for you. Thank you very much.